Hello everyone, I am Dr. Narcisa Ianopol, and in this video I want to share with you what I know from my medical training and what I have learned from online self-teaching about sleep apnea symptoms and diagnosis. This video is paired with a similar article on my website iStory with Narcisa that you can read if you click the link in the description below this video. I like to make publications online as video and written articles in order to be available for everyone to see or listen to, including to people with hearing impairment or visual disabilities. Before we start, I would like to underline that none of my online publications, this one included, do not offer any medical advice to anyone, do not push anyone to follow any actions for themselves, nor to purchase any of the advertised products from any of my online platforms. If you want to read more about the purpose of my online education works, please read the chapter Disclosures and Agreement Privacy Policy of my website. This work is designed to bring light to the knowledge and empower with science people with sleep apnea. This is a part of our union project and is a work designed for education and empowering only. Before you decide to follow any idea described in this video or paired website article, please discuss first with your doctor and sleep apnea specialist because each patient is different and should have different management adapted to their case. So, what is sleep apnea? The word apnea means stop in breathing. Sleep apnea is a sleep disorder characterized by stops in breathing for different periods of time from several seconds to several minutes. It is a chronic condition that can last several years or, in some people, lifelong. It is a condition that requires diagnosis done by medical professionals and specialized treatment and monitorization done by specialized personnel. 1 from 10 people suffer from sleep apnea. As per Mayo Clinic reports, more than 200,000 new cases are diagnosed every year in the United States. Sleep apnea can appear at any age, but it is more frequent in adults than in children. It is also twice more common in men than in women. For obstructive sleep apnea, that is the most common from the 2 clinical forms of sleep apnea, the highest risk factors are aging and obesity and overweight. Because this condition does affect the sleep quality, patients with sleep apnea experience various degrees of tiredness and other consequences of the lack of sleep that you can see more detailed in the first video of this collection entitled Sleep, Snoring, and Sleep Disorders. Click the link in the description below this video to watch that video. In children, sleep apnea may cause hyperactivity and issues in school. When we talk about the causes of sleep apnea, we need to separate the 2 main clinical types. Central sleep apnea, CSA, produced by central nervous mechanisms, and obstructive sleep apnea, OSA, in which the stop in breathing is produced by blockage in the throat by own soft tissues during sleep. There are patients with complex sleep apnea in which the mechanisms of both forms are present in different proportions. An international classification differentiates adult sleep apnea from pediatric sleep apnea. The most common form of sleep apnea is obstructive sleep apnea that is seen more often on older people and overweight, obese individuals. During sleep, when the whole body relaxes, the soft tissues consisting of tongue, other muscles, ligaments, and other components of the deep throat, called soft palate, are relaxed too. Especially when the person is sleeping on the backside, the relaxation of the soft tissues from the deep throat makes this bulk tissue to fall into the deep throat and block the airway, producing stop in breathing. Usually people struggling with obstructive sleep apnea have also problems with snoring and gasping when the breathing stops once the throat is blocked in this way. Counterintuitive from the mechanism, obstructive sleep apnea is more frequent in older individuals because with age, all the tissues in the body are softer and with less tonus. It is also more frequent in people who are overweight or obese because in these people, throat has more amount of fat tissue that contributes to narrowing of the airway and also creates more soft tissue that can block the throat during sleep. This mechanism is more detailed in the previous video of this collection called Snoring Remedies Solutions that you can watch if you click the link in the description below this video. In central sleep apnea, there is an issue with initiation or maintaining the regular breathing in the brain. Indeed, the breathing is happening regularly because in our brain there are breathing centers that control this process. The centers that control a specific rhythm of breathing are located in the medulla and pons of the brainstem that are parts of the brain. These centers are located in the lower part of the brain, close to the place where the spinal cord goes out from the skull and enters the spinal canal. You can see this place shown in the slide by the tip of the arrow. Because of this particular position, breathing may be affected in multiple situations in which this lower part of the brain has various lesions, for example in trauma, increased intracranial pressure from brain hemorrhages, or in a congenital abnormality of the brain that is called Arnold-Chiari malformation. In this last mentioned abnormality, the lower part of the brain is abnormally lower that makes the brain to get engaged in the foramen magnum together with the spinal cord that goes out of the skull. Consequently, there is increased pressure on the pons and medulla in the region with breathing centers that may produce stop in breathing. That is why people with central sleep apnea should have specific investigations, including brain scans like MRI, to exclude Arnold-Chiari malformation. That is a condition that sometimes may be life-threatening. Because stop breathing during sleep may be associated with many diseases, even if they may be rare, it is very important for all people experiencing snoring and stop in breathing during sleep to be examined by specialized physicians. Even if I am not a doctor specialized in any of the medical specialties that take care of people with sleep apnea, and even if the educational materials available online that explain symptoms of sleep apnea are listing as symptoms just the consequences of this stop in breathing, for educational purposes, I feel to explain in my videos and articles the symptoms of sleep apnea in a different way. My particular organization of symptoms aims to raise awareness of possible sleep apnea in people who are snoring, but they were not diagnosed before with this condition. And like all the other videos and teaching materials for the public available online, I also want to explain the consequences of sleep apnea and its manifestation. For these reasons, I divide the symptoms of sleep apnea in two main categories. The first category is that of symptoms that should raise suspicion of sleep apnea. In this category, snoring is the most relevant symptom because about 20% of patients with snoring may have another condition hidden behind the noise. Most of the time, sleep apnea, all people who are snoring should have a sleep test, Polysomnography PSG, to explore causes of snoring. All the symptoms described next, even if they are present in patients who were not diagnosed with sleep apnea, like tiredness, difficulty in concentration, even in the morning, heart rhythm problems, raised blood pressure, etc., should be investigated to have excluded sleep apnea. Another symptom that should raise alarm is shallowing or stops in breathing during sleep that in people sleeping with others are usually signaled by their bedmates. Many times, though, people may sleep alone and have nobody to raise the alarm of possible snoring and stops in breathing during sleep. So consequences of sleep apnea seen in these people, as mentioned below, should trigger a specialized consultation by a doctor. Symptoms in people with established diagnosis of sleep apnea is a second category. Besides the already known snoring and stops in breathing during sleep, people who are already diagnosed with sleep apnea already know from their physician that they have an explanation for symptoms of lack of or poor quality of sleep. These symptoms that start with tiredness, irritability, difficult concentration, memory, etc., are extensively explained in the first video of this collection entitled Sleep, Snoring, and Sleep Disorders. Click the link in the description below this video to see this video. Of course, in people having other conditions associated with sleep apnea, there are multiple other signs and symptoms characteristic to those disorders about which we do not discuss in this video, but they may exist. That is why people with sleep apnea should be completely evaluated by specialized physicians. Even if snoring and stop in breathing in someone's sleep can be witnessed by their bedmates, that is a valuable alarm raised for people who have sleep apnea. The diagnosis of sleep apnea should be done by a specialist physician. The confirmation of the diagnosis that we call positive diagnosis of sleep apnea is done with the sleep test, otherwise called polysomnography or abbreviated PSG. This test confirms the stops in breathing during the sleep and more. After confirming that someone has sleep apnea, it is obligatory to search for the cause and to establish the type of sleep apnea, whether it is central or obstructive or both. For this differentiation, the primary care physician or family doctor may consider referral to specialist physicians in neurology, neurosurgery, ENT, respiratory, etc. Apart from the physical examination done by these physicians, like simple examination of the nose, mouth, throat, and ears done by the ENT doctors, more complex investigations like chest CT or MRI of the brain may be necessary in some cases, adapted to each patient. Without these steps, simple noticing that the person stops breathing and then to say sleep apnea and need for CPAP machine for the rest of their life is just a superficial judgment in my mind that does not serve the patient in any way. With this entire project, Sleep, Snoring, and Sleep Apnea, I want to honor my lifetime commitment as a physician to serve the patients of any kind, and I want to raise awareness of the need for complete evaluation done by appropriate specialist physicians for all those with snoring and stops in breathing during sleep, as well as for all people already diagnosed with sleep apnea. Another very important question that should be answered for all people with clear diagnosis of sleep apnea is their stage of the disease, whether early stage, advanced stage, that is usually established by the vital parameters of the polysomnography, as well as by the other investigations that reveal the consequences of the sleep apnea. In my mind, as a physician who does not accept just recommendations without clear explanation why the patient needs this recommendation, a patient with sleep apnea should have precisely judged by their specialist whether they really need CPAP machines or other more complex devices, or they just need oral devices to prevent airway blockage during sleep. This is because to wear every night the CPAP machine is not easy and may not be the best choice in all patients with sleep apnea. Sleep test, also called polysomnography, is used to record multiple parameters during sleep that will help establishing the diagnosis of sleep disorders, including sleep apnea. The test is usually done overnight in order to catch the natural sleep. The full test is done in the sleep lab. A less complex device with recordings for the main parameters can be given to the patient at home to record the sleep overnight, and then the results are interpreted by the sleep specialist. The full sleep test records the following parameters: brain activity, waves, called electroencephalography; eye movements, called electrooculography; muscles activity, electromyography; heart rhythm, electrocardiography, and the pulse; breathing and respiratory effort; oxygen level in the blood; other parameters like sleep onset latency, REM sleep onset latency, number of awakenings during sleep, total sleep duration, percentage of each stage of the sleep. You can see more about sleep and sleep disorders in the first video of this collection called Sleep, Snoring, and Sleep Disorders. Just click the link in the description below this video. A simpler version of the sleep test is sometimes given by the sleep medicine physician to the patients to record the most important parameters of the sleep tests in order to establish the positive diagnosis of sleep apnea. On the other hand, there are multiple self-administered tests for the monitorization of these main parameters in sleep apnea patients that need to be evaluated more often by the patients themselves rather than just occasionally in their physician office. An example of this self-administered sleep test is done with a wireless ring from Amazon, operated by an application on the computers or smartphones. This wireless ring is very easy to be worn at a finger during sleep and will record the pulse, sometimes the same as heart rate, oxygen levels, and motions of the body. The patient will be able to continuously assess if the sleep apnea is under control or not. I bought for my family this ring that is very handy and simple to be used during sleep. It does record over 16 hours of sleep, the oxygen level, the pulse, and movements of the body that are the most relevant parameters to raise the suspicion of sleep apnea in somebody with not diagnosed condition. On the other hand, for people already diagnosed with this condition, the ring allows monitorization over time of these parameters and comparison before and after different treatments, including after the use of CPAP machine. This device has an application that can be operated from a computer or smartphone and can have set up alarm when the parameters are outside of the normal limits. Because I am very happy with this product, I included it in my Amazon Associate program. That is why you can find a link in the description below this video. My disclosures for this program are, as Amazon Associate, I earn from qualifying purchases. Click the link in the description below this video and visit Amazon website, where you can see information about this product and many other products for sleep apnea produced by different brands. Before I close this video, I would just like to make a short comment about the pulse and the heart rate. In people who do not have rhythm problems on their heart, the pulse is the same as the heart rate. In patients with heart rhythm problems, the heart rate is sometimes higher than the pulse. But for the regular patients with sleep apnea without heart complications, the recording of the pulse is the same as recording of the heart rate. Thanks very much for watching. This video is dedicated with love to all people with sleep apnea. See you in my next video.